So I think now we've got over 150 participants. So thank you everyone for taking the time. I know we didn't give a lot of notice on this, and that's because we didn't get a lot of notice before the announcement was made towards the end of June, that the government, the provincial government and the federal government in partnership were going to be developing a tracing app. And so anyone who is part of the CDAO and the CEC, and I think both of those groups as partners, know that we've been paying particular attention to what we call the 3 T's. And so the 3 T's are tracking, tracing, and testing. And we view those 3 T's as a way to go from being going from being reactive to COVID-19 to being proactive and starting to manage this. And obviously we have to do that with our partners in health and safety. And so off the top, I'd like to thank all the construction workers out there that have essentially given it their all and done what they've needed to do to, one, stay working, but more importantly, to do it in a way that keeps Ontario safe. They're keeping themselves safe, they're keeping their family and their friends and everyone in Ontario and Canada safe. So those efforts are much appreciated and they're noted. I also have to mention the work that the CDAO did and the members of the CDAO did. When March 16th happened and there was the shutdown and pandemonium was created, the CDAO formed a small working group together, and they worked very closely with groups like RONS and the IHSA, and there was a tremendous push and focus on health and safety, and it was right out of the gate. And I think that's one of the main reasons why construction was the first sector to have health and safety guidelines related to COVID-19. So again, thank you to CDAO, CEC, Ron and his team, all of the Ministry of Labor and IHSA. Moving forward, I think a lot of us were hoping that we'd be further along and COVID wouldn't be as dominant as it is now. And I think some of us are starting to think about the second wave, and that's why we got this webinar going, to understand more about this tracing app and how we can use it to manage on-site activity and keep workers safe on a going forward basis. But I think we do need to outline, especially in a health and safety call, the risks associated with COVID-19. And right now, the largest risk is complacency. And what I'm specifically referring to is the 6-meter rule, the mask rule, and washing your hands. So what we've learned, and we'll learn more today, is if you wear a mask, if you wash your hands often, and if you stay 6 feet apart, we're really going to make a dent in the spread of this virus. And I would please ask everyone to guard against complacency amongst themselves, but also in their workplace. So with that, I do have the honor of introducing Ron Koletsky, who's the Chief Prevention Officer with the Ministry of Labor, Training and Skills Development. Ron, I think, was an excellent CPO before COVID hit, but he certainly has elevated himself since. He's been, very stable and really had a stable hand on the tiller and on the wheel, kind of guiding Ontario as we've dealt with COVID-19. He came from and was the president and CEO of the Public Services Health and Safety Association, and so he had an excellent background kind of for this pandemic. And I don't think many people on this call need an introduction to Ron, so I'll leave it with that and I'll turn it over to him. So thank you very much, Ron, for all the work you've done and for the presentation today.
Thank you, Andrew, and thank you for your leadership. I mean, this is not sort of the first event that RESCON has put on in conjunction with other members of the construction industry, but I think you're right, it's important, especially through this period, that we communicate. I'd also like to thank you and the OGCA for your leadership. You're correct. We got out of the gate. We started working with the construction industry, IHSA, RESCON, and OGCA somewhere around March 12th. And it was March 20th that we had a draft document that we widely distributed throughout the industry. And then that was picked up in more of a formal document by the government on the 29th of March. And we took a look at it. It's had over 700,000 hits. And I think it's a reflection that the construction industry, in its essential mode, and essential, there was about 50% of you in operation at the time, up to the 19th of May, where it became full-time. The number of COVID outbreaks that occurred in construction, not only in Ontario, but across Canada, has been low, and really that represents the leadership and diligence that the industry has taken. I have a few remarks today, and I'm joined by a colleague, Jacob Kornenblum from MGCS, who's um, is the Ontario government's representative for with the federal government on the tracing application, and I know that's of interest to you. So we'll just go through a few of my slides. Andrew, the next slide. This is me in happier times. No, next slide. So just to give you an example, so since this started, actually I was actually looking at an email that I sent out in January to widely across various sectors, including construction, and saying that we had to take a really long look at what's happening with this pandemic, and it was in its early stages. So again, really congratulate construction on its leadership throughout that. So it was an example of a sector that was able to remain open while at the same time preventing the spread of COVID. It was also a sector that started to examine some of the issues of construction sites that have become really the cornerstone of our efforts over the past 4 months, that being how to effectively use the hierarchy controls, how to maintain social distancing, how to screen and restrict entry to construction sites, how to essentially clean up construction sites. And, you know, we worked with construction and we worked with our inspectorate and IHSA. We set up teams to be able to move around construction sites, not to be punitive, but to actually help constructors understand what their obligations were and how to guide them from a compliance perspective to, you know, how do you wash hands when there's no water available? You know, what are the protocols that are needed to keep a workplace safe? So this information started out early, and I think that is, again, as we've stated, some of the reasons why construction has done so well. So I'm just going to do a few things about talking about collaboration with our partners in the construction sector and how we've maintained safe workplaces in spite of COVID-19. Next slide, Andrew, thank you. So, so many parts of the construction were deemed essential, and as I mentioned, it was one of the first specific guidance documents that we sent out. And I'd like to say that the world was so impressed with what we did with construction. We sent out an overarching guidance document, and from that, a number of sub-documents that were posted on the IHSA website. And while the overarching guidance document talked about specific elements related to the hierarchy of controls, the sub-guidance document started to talk about the minutia. What do you do when how can you put 2 people in a crew cab? How do you clean a washroom? What are choke points on construction sites? So there were well over 25 sub-documents that were created from the main document, which also helped the industry in its quest to be safe. And based on that model that came out of construction, we have developed over 170 sector-specific guidelines to help industry, not only other essential businesses, but businesses as they moved into phase 1 and phase 2, and now phase 3. So we have a whole unit set up that works with the health and safety associations to be able to develop those guidance documents to help all of Ontario become safe. And in fact, we've also expanded the concept of having the health and safety associations work explicitly with employers like we did with construction. We've done it with meat processing, and we're now doing it with temporary foreign workers. And we established a team that went around to do risk assessments to open 40% of the courthouses and 25% of the courtrooms in Ontario, and we're expanding that to other public sector organizations where we're doing risk assessments throughout the province. In addition, we've developed guidance notes, tips, videos. We've got 7 videos in the hopper, which are anywhere between 1 and 3 minutes long. They're animations that are designed to be able to quickly help both employers and employees understand how to stay safe in a COVID environment. And as I indicated, as of now, we're well in excess of 800,000 times that these pages have been visited since being released. Next. So in addition to help the industry out, earlier on, there was a concern that with the closure of training capacity, what would we do about working at heights? So we granted an extension from those workers who from February 28th to August 31st, they'd be granted a 1-year extension. Now, as of this month, we've been able to open up training facilities across the system. So with limited capacity, those that are entering the system or have expired will be able to take or are taking working at heights. And there was over 120,000 people affected by the extension, so they actually have a 1-year period. We're also developing a comprehensive plan to mitigate the effects of the validity period on workers and employers during the COVID outbreak. And this would allow us, should there be a rebound or an echo effect in the fall, we want to watch that very closely so that employers don't feel that they have to be compromised to hire people that are unqualified, and that we're able to provide workers with the opportunity to get qualified or not be concerned. Next slide. In addition, as I mentioned before, we face-to-face training is open, and we encourage safety providers to consult with their local medical officer of health just to make sure that they follow not only the public health guidelines, but the guidelines that we've established under through the Ministry of Labor Training and Skills Development. We've accelerated the process, so now you can get Joint Health and Safety Part 1 fully online, and both Part 1 and Part 2 you can now take through distance learning, which is basically like we're doing now on a Teams or Zoom platform. So that is available. And we're suggesting the opening of training. It's able to operate in person just as long as they comply with public health guidelines. So that is depending on the location, whether it's 5 or 10 people, as long as you maintain the physical distancing and where appropriate cough and sneeze protocols and hand washing. So if you're following those rules and the hierarchy of control, then we're fine to open. We're also working with skills development to open up the training centers so that skilled trades examinations can start taking place. Hopefully we'll get that up and running by the middle of August. Next slide. So we announced a program last week. We have $3 million that we've acquired through the employment service side, not the health and safety side, to provide free online training through employment service offices across the province. So employment services offices offer support to workers who have been unemployed, are seeking jobs, or a new immigrant status. So with well in excess of 2 million people sitting at home, we thought it was a great opportunity to be able to open the system up and to provide online training through the employment services offices. And this is going to be really part of a large overhaul of the health and safety training system. So right now, training is provided through the private sector, large corporations that have the in-house capacity, and certainly through the health and safety associations. So we're really looking to expand training to go beyond what is already available in the secondary and post-secondary institutions. We've now got a pilot project that is going to operate through employment service offices, so that'll help with new immigrants and the unemployed. We are looking at standardizing training curriculum for the trades so that the 52 trades and sub-trades have a standard training, health and safety training curriculum. We're also looking at modular training, and so it's more of a comprehensive case. We have a minister that is very interested in ensuring that health and safety becomes the cornerstone of employment, and we're working at not only the means of delivery, the quality of training, the outcomes expected in training, but also ensuring that everyone who is at any point within the employment cycle has access to training. So right now we're going to try this pilot project to affect 100,000 job seekers that can actually take up to 10 health and safety programs, and you can see that at the highlighted version on the bottom of page 9. What's really important is we felt that some of these programs would be beneficial to people trying to get a job, especially in small business. That's why we're offering health and safety rep, and then some of the more common elements of health and safety. What we want to do at the end of this is, once we evaluate the pilot, we would be hopeful if somebody is seeking a job in construction, that only construction-related activities and training be provided through this program. Similarly, if you're moving into general warehousing, general labor, retail, or so on, we would tailor these programs. So at this point, it's just a pilot project, but a very important one. And as I'd mentioned, this funding came through employment services and not through the WSIB. Next slide, please. There we are. I just wanted to give you an indication in construction where we sit with fatalities, and I've done a comparison between 18, 19, and 20. So the first 3 months of the year, we were trending higher than our best year, that was 2019 or last year. However, what we see in 2020, touch wood, that from April to June 30th, there were no fatalities in construction. So overall, for the period, we are certainly trending slightly better in the first half of the year than we did before. And the top graph is simply where we are as of all sectors. So we're at 21 fatalities for 2020 compared to 17 compared to 30 in 2018. So some good news and some sort of good news coming out of it, but clearly construction through the period of April to June had no fatalities, and that's certainly a first for the quarter that I'm aware of. Next slide. We do have the strategy, and I was saying we have the strategy written and it's going to come out honest. We're just going to hold back on it for a couple of more months because we just want to see what the effects of COVID are, because we believe that this is a game changer in terms of where we need to focus. Just things like infectious prevention and control protocols. There's been a lot of change and a lot of, I would say, positive aspects that are occurring within not only construction, but across all sectors in the province. So we're likely going to release the strategy in the fall of 2020, and that may be scheduled if there is an echo effect with COVID. We just didn't want to release the strategy in the midst of something where nobody's going to pay attention to it. So we've done a lot of consultations. We've incorporated a lot of the ideas that came from both stakeholders and as a result of our online and in-person consultations. But essentially, we're looking at moving towards outcome evidence-based programming, dealing with high hazards, and concentrating our work on small business. We know that 62% of injuries are occurring in organizations of 50 or less, and we want to focus on those businesses and provide the tools to others to be able to become more self-sustaining. Next slide. Okay, so I think you're keeping questions to the end, and I'll turn it back to Andrew. You have the schedule of event, whether Jacob's is scheduled or however you've got it managed. We'll take it from there.
Yeah, and I don't know, do you want to introduce Jacob, or do you want me to do a quick introduction? Because we'll slide in with Jacob next, and then we'll kind of do questions for you and Jacob at the same time, if that makes sense, and then we'll turn it over to Mike.
Okay, that's fine. Go ahead, introduce Jacob's.
Okay, let me pull up his presentation. Taking a second here. All right. Just gonna have to find it again. Just 1 second, everybody. So I will try and do two things at once, and I think anyone who knows me knows that's probably not the best idea, but here I go anyways. Find the presentation from Jacob. So Jacob is very talented, and he has the pleasure of working with the federal government. So I'm just pulling up his app now, or his presentation now.
Sure, Andrew. I mean, I can launch in if that's easier. Okay. while you're finding it.
With the Ontario Digital Service, and essentially he's one of the key people from the provincial government working with the federal government on introducing this tracing app. So
got it. Absolutely. Good afternoon, folks, and thanks to Ron for the opportunity, and to Andrew as well. So yeah, as Andrew mentioned, I'm the head of policy for Ontario Digital Service. We are part of the Ontario Public Service. Recently moved to be under the Treasury Board Secretariat, but we are basically the team in government that designs and develops digital services that the Ontario government releases. And so one of the things we've been working on is the app that you may have seen referenced in the media over the past few weeks. And it is the exposure notification app called COVID Alert. And so what I'll do is give you a quick walkthrough of what exposure notification is, first of all, and then what the app does and what we're aiming to do. And then, as Andrew mentioned, happy to take any questions. So first, just to clarify, I think in the media and in conversation, we often hear the term contact tracing, and that refers to the process of typically public health calling you on the phone if you've tested positive for COVID, and basically interviewing you and asking you, hey, in the last 2 weeks, who are you around? Whose names can you remember? What phone numbers do you have that you can tell us? And they'll write that down in a list, and then they'll call those people and they'll talk to them. And basically it's this kind of tiered process of trying to stop the spread by manually calling everybody and trying to figure out who was in contact with whom. Exposure notification is a bit different. It complements that process I just described of the kind of phone tree. But basically how it differs is that it is anonymously notifying everyone who you may have been in contact with, if they're using the app, which I'll get to in a moment, about the fact that they may have been exposed. And this differs from contact tracing in that contact tracing is, phoning you and saying, hey, Ron, who are all the folks who you can remember being around? So on the job site, who are you working beside? When you went to get lunch, who are you sitting beside? When you went home, who in your family were you interacting with? But it doesn't account for all the folks you don't know. Somebody who's come in, again, a tradesperson who came in for the day who you don't know was working beside you side to side for an hour plus. Somebody, if you're taking transit to and from the job site, you don't know the people sitting around you. So we want to have a way to complement and support what's going on through the phone call process by extending that notification process to the folks you don't know. And at the same time, we want to do that in a way that protects everybody's privacy. So you can discreetly, but quickly tell other people, hey, you may have been exposed. So that's how exposure notification differs. And again, typically it uses Bluetooth on your phone, which I'm sure most of you are familiar with, or you've used in some capacity if it's syncing up your speakers at home or what have you. It doesn't use GPS, doesn't track your location. We'll get into that in a moment. But basically, again, what it's trying to do is anonymously tell more people more quickly if they've been exposed, and they can take action sooner. They can self-isolate, they can go get tested, they can follow the prevailing public health guidance. So that's just briefly what exposure notification is and how it's different from, the contact tracing and tracking that you're hearing about in the media. This thing does not do that, and we can talk about the pros and cons of that as we proceed. On the next slide, you'll see a little bit of a background on what we've done here in Ontario. So we decided to develop an app in-house, building on free open source code that was available and made available by volunteers from Shopify, the e-commerce company. And so we took that free open source code base, built a prototype on it, and now, as Andrew mentioned, we're working together, provincial and federal government hand in hand, to develop a final app that's going to launch in Ontario this month, we assume, but then could eventually roll out across the country. So again, if you're traveling for work purposes or family or vacation, ultimately, if we get back there to another part of Canada, this app's going to work and it's going to interact with other apps that other provinces may release as well. And the reason why we chose this solution is, again, and I don't mean to, kind of be a broken record here, but it's really the most privacy protective option. And it has one purpose in mind. It does one thing and one thing only, which is, again, notify you if you've been exposed. Doesn't ask you where you've been. It doesn't ask you who you've been near. It's not collecting that data. We're very sensitive to, what we're seeing going on in other parts of the world. Other folks have launched these apps in other jurisdictions, everywhere from Alberta, that's come out with the first in Canada, to Germany, to Japan, so literally all over the world. And we've watched very closely what the general public and what different sectors such as constructors have said in those markets. And really the message has been clear, which is we want to be able to help and be helped. We don't want the government tracking where we're going. We don't want this to be the thin edge of the wedge into other surveillance and so on and so forth. So being very, very mindful of that, we've opted to use this platform. And we like it because, again, it can be customized to contain and offer the Ontario guidance that we all need, because Ontario is not BC, it's not PEI. The situation with COVID is different in each place, as we all know. And it uses a new platform that's launched by Apple and Google, again, which you may or may not have read about. Basically, that platform for the first time lets Android and iOS phones interact with each other to exchange info. And it also it enables the app to run in the background, so it's not draining your battery life. It's very light touch when you download it, you use it. You don't need to have it open in the foreground of your phone. So just on the next slide, again, the key priority that we see here in order for this app to succeed is user trust. And the app, as with any of the apps, and Michael's going to address this, I think, in his talk as well, this app can have an effect, even if it makes a difference and a dent in 10 work sites in Toronto or in 15 work sites in Hamilton. But scale really drives the power. So the more people who use it, the more effective it is. You need to be interacting with somebody else who's got the app in order to detect that they're near you and that you've been exposed or you've had an encounter. So the more people who use it, the more effective it is overall. And so what we want to make sure is that we're clear on what it does and it doesn't do. It does, as I've said before, help more people, and especially the folks you don't know. You're in line at the grocery store, you're on the bus, they can get alerted if they've been exposed. It connects people with public health guidance that's up to date, tells you the latest. It automatically destroys all data related to the app every 21 days. So it's not storing, using, hosting, anything of that nature. 21 days and it's done. Works across all devices and it interacts with other apps. And again, just to reiterate what it does not do. So it doesn't track or trace people or their contacts. It's not gathering your phone number. It's not gathering your address. It's also not designed to be a mandatory or gating factor to access job sites. So while we, again, as the province, are encouraging actively the voluntary use of the app, we're being pretty clear to say that, as an employer, really you're not able to compel folks to use this app. We're not recommending that you, ask to see people's phones as they show up to the job site to say, hey, show me your device, let me see your status on the app. Again, we want to protect privacy and give users choice. This is not intended to be a mandatory tool that everyone must use across the province. We're of course encouraging folks to use it, but it is not designed for employers to say, hey, you want to work on this site, you got to show me that you've downloaded the app. We really want to put the power of choice in individuals' hands. And again, no personal health information, no personal data, no tracking, and so forth. So how does the thing work? I'll show you on the next slide and give you a quick walkthrough. So you download the app as you would any app from the App Store to your device. And that's all you need to do. Once you set it up, it runs in the background. There's nothing else that no other action you need to take. And hopefully, frankly, you'll never interact with it. You're never going to get a ping from it. You're never going to have to ping anyone. As we know, the caseload right now is under 200 new cases per day. Obviously, we're all hoping it stays that way and goes south of there. But on a normal day, you go about your business, you go to your job site, you go to work, you go to the office. Anytime you're near another user of the app, you and they are going to explain, for sure, I'll explain how it interacts with TraceScan. Anytime you're near another user of this app, which is called COVID Alert, you and they will exchange what we call a digital handshake. It's anonymous. It's a randomly generated string of numbers that travel between the phones. Not your phone number, not your name, not anything about you. You trade a random gibberish string of numbers. Those get stored temporarily on your phone, but that's all it is. And every time you encounter someone, you're trading these numbers back and forth, random, anonymized, encrypted. Now, later on, let's say you go about your work a week later, you start to feel feverish, you have a cough, you decide, you know what, I'm gonna go get tested. When you get tested now in Ontario, the main way for most tests, close to 90%, that you get your results is through something called the Ontario Lab Results Viewer. It's a website, it's up there now, you can go check it out after the call. You log on there and you get your lab result, positive or negative. What's going to change now when the app launches is that you'll be able to then say, okay, I want to anonymously notify anyone who I might have interacted with and given that anonymous digital handshake to in the last couple of weeks. And you'll get a code on the lab results viewer. It's an 8-digit code. In the same way you might get pinged for two-factor authentication by your bank or another e-commerce channel, they'll say, we're gonna send you a little code to your phone. You gotta enter it in. You've got a time period to use that. If you go to the next slide, you see how that works in practice. So you take that code, you enter it into the app, and then you're being asked, again, you're being prompted, it's your choice. You could, for argument's sake, use this app, and if you test positive, you might never want to tell people. Again, obviously, we're encouraging the whole purpose of the app, we're encouraging you to tell people, but if you've decided for whatever reason you don't feel comfortable, you still don't have to. So if you choose to notify people, you'll get a screen that says, do you want to anonymously share this information with others? And if you do, then what happens is anyone else who's been near you in the past 2-week period will get a notification through their app. It's discreet. It's not popping up on their lock screen. And it says, hey, you may have been exposed in the past 2 weeks. Here's what you need to do next. Self-isolate, get tested, seek guidance, and so forth. On the next screen, these are sample screenshots of what it actually looks like. My only caveat here is that the final app is going to look a little bit different. It's been piloted and we're doing a few updates in terms of what the look and feel look like. But on the left, you see the onboarding screen. So when you first download it, you get a pretty clear rundown of this is how it works. The second screen here with the check mark is saying you're good to go. So anytime on a normal day you open your app and you see how you're doing, you're good to go. Green light. The third screen says if you test positive and you want to anonymously notify other people, you would press that blue button or something like it, and you'd enter that code I mentioned, which you got on the lab results viewer. And the reason we have this is to make sure that just because you wake up and you feel a bit feverish one day, you're not autonomously by yourself saying, hey, I want to send the alert out to people. You have to have a confirmed positive test result from public health in order to trigger that send out. We want to do it right. We want to make sure there's no mistakes here. And the last screen with the hand up is something like what you're going to see if you've been exposed. It's discreet. It just says, hey, here's what's happened. Click on the black part of the screen there, and we'll tell you what to do next in terms of getting tested. Last thing, and then happy to open up for questions. You may be wondering, well, how does it determine whether you've been exposed and whether you've been near someone? So Apple and Google, which set the standard for every country that wants to run this kind of app, have focused on three things. How long you've been near someone, cumulatively. So you can be near them, go away, come back again, and that keeps adding up to your total time around that person. The number of days since you've been around them. So if you're around somebody and they test positive for COVID, but you were around them 3 months ago, you're not getting a ping on your phone because that time frame has passed. If it's within the last 5 days, they test positive, they've said, hey, I want to tell everyone anonymously, you're going to get a ping. And the last thing is the distance. And just to clarify, so where it's being set now for launch in Ontario is the cumulative duration is 15 minutes and the distance is less than 2 meters. So what we're saying is anytime you've been within 2 meters of somebody for a period of 15 minutes or more, and yes, I know if you were there for 14 minutes and 59 seconds, are you going to get a ping? We have to draw a line somewhere to start. And so that's where we've landed based on public health guidance for now. This can change also over time. It can be recalibrated by public health in Ontario to reflect any new guidance that comes out. So just final slide to wrap up. Where we're at right now is preparing for launch. We anticipate launching this month. You may have seen an initial announcement both from the Prime Minister and the Premier, again, working together with the federal government and the provincial government. We here as the public servants, we're not the political side of things, we're the public service, and so we support the government in its work by preparing the app for launch. And we are meeting again with folks right across the spectrum, educational institutions, colleges, folks such as yourselves, associations, to really present the work and then take questions and get feedback. So with that, yeah, happy to turn it over back to Andrew and any questions folks have. I can speak to TraceScan if you'd like to kick off, but Andrew, I don't know how you'd like to moderate the Q&A.
Yeah, I think Amina will ask the questions, but maybe we'll kick it off with that question and then Amina will ask them so everybody can hear. And we'll probably take about 5 or 10 minutes, Amina, for questions, okay?
Sure. So I can speak to the TraceScan question. Then I see, Ron, I think there's probably a couple that are related to your presentation for the training. So as you may have seen, there was an announcement in the last week or so. The Ministry of Labor noted its support for a technology called TraceScan. And that's a wearable solution that is designed to be worn, as far as I understand, it's designed to be worn on sites or in any location, and is more geared toward proximity testing and tracing in a more detailed manner. The application is produced by a company called FaceDrive that's based out of Waterloo. They noted in their release that the technology is designed to interact with other solutions. And I think, what we're going to see more broadly, and Michael's going to cover this a bit more in his talk, this is the government of Ontario's solution at scale for Ontarians from every walk of life, young and old, working, not working, in school, what have you. We're already seeing an ecosystem developing from private companies, whether that's, PricewaterhouseCoopers, whether that's IBM, saying, hey, for our assembly lines, for our plants, for our workplaces, we're also going to ask our employees to be using ancillary technology. To me, I liken it to, you use iTunes on your phone and you use Spotify as well. Or, you bank with TD for some of your stuff and you bank with Scotia for others. The idea here is that it's an ecosystem and these solutions support each other. The provincial app is designed to be very light touch. The Prime Minister's words were, you download it, you forget it. You don't have to think about it. So I think, different sites, different constructors may start introducing their own technologies. They're all designed to work together and achieve the common goal, which is effectively slowing the spread. So in our view, the more the better, in the sense that, the more kind of stopgaps we have and the more fail-safes we have on sites to make sure that, work environment is safe, that's great. The province's app is trying to bridge the gap between you and your family members and your friends, who aren't working in your workplace and have different employers as well. So we're going to see a matrix of different solutions, and again, that's okay. The more we can do collectively, the better.
Okay, there was another question regarding promotion materials about the app. Will those be provided to local construction associations to broadcast to their membership?
Yeah, it's a great question, and maybe just tacking on David's question that I just saw there. So yeah, I mean, we're happy to participate in Q&A and others like this. You know, in terms of raising awareness among workforces. Public Health Ontario is working now on guidance that they're going to be distributing in general across sectors, and so most likely the guidance to employers is going to fall under that. So there will be, you know, as Ron was alluding to, I mean, other guidance you're going to receive in general in a package. We don't want to reinvent the wheel or kind of clutter people's inboxes. So the approach we're working with now is it's going to be dovetailed and it'll be included in other guidance that will be sent out. And then in terms of info sessions, yeah, I mean, again, we're happy and from the Ontario standpoint to go far and wide and help spread the word. So you just let us know what you need, maybe via Andrew, and we're happy to go from there.
And then I think there was, well, there's another question for you, Jacob, about GPS.
Yeah.
And the distance. And then there's two questions for Ron after.
Yeah. So so Bluetooth is just a different feature on your phone, and it can detect proximity. So if you ever tried, again, if you've got like a home audio system and you're syncing your speakers or any other devices, two devices to each other, it has nothing to do with GPS. It's literally like, what's the distance between two objects, not where are those objects in space, if that makes sense. Like, is one object in Toronto and one object in Hamilton? It's just how close are those objects together. And so Bluetooth enables you to basically detect the proximity, whether you're within a 2-meter range or not, and then exchange that anonymous digital handshake. And then it works. Awesome. Do everyone? Yeah, I mean, so the thing is, Rafid, as I'd said, so you know, you do need, for this digital handshake to happen, both people involved need to use the app. So if you're on a work site and you have the app and the guy next to you or the person next to you doesn't, yeah, I mean, it's not going to work. And so I'm just being candid about that. And so this is why, you know, we want to do a hard push to ensure that as many people have it on your phone. And again, you download it, you forget it, you go about your business.
Okay, so for Ron, before I move on, is there a maximum number of participants for in-person training?
Just part of the hierarchy requires you to take a look at your training facility and how can you determine that you can safely distance between participants, where are your choke points, what about your lunchroom? You take all that into consideration. So it really depends on the size of your facility. When it first rolled out, it was, you know, you weren't allowed to congregate in groups greater than 5. That may change depending on what local municipalities, public health has said. If they said, you know, you can congregate in 10, that's fine. You think about it when you go into a store, you usually see in the doorway that due to COVID, we only allow 15 people into the store. And that's based on their risk assessment that determines that they can't safely guarantee proper physical distancing in the facility, so they limit the number of people. So it really depends on your training facility. So anywhere from 6 to 10 in a typical classroom, if you consider a classroom like you used to have when you went to school, separating your desks, making sure that as long as they're physically distanced, they don't necessarily have to wear a mask, but when they get up to leave from their desk, they have to put a mask on, you know, so there's all kinds of considerations that would be undertaken during a risk assessment that would determine that.
Okay, and then there's one more question. Is the free online training available to people who currently are employed or just those seeking employment?
So you would have to be registered with one of the employment service providers. So if you've been unemployed or furloughed, you're actively job seeking, or you're a new Canadian or new immigrant, then you would be eligible to take it. But if you're employed and not registered with one of the employment service providers, you wouldn't have access.
Okay.
That's all the questions. So a big thank you to both Ron and Jacob. Um, much appreciated. I think there was a lot of great information shared there. And while I think the pace of change is slowing down a little bit with COVID, it's still much faster than, quote unquote, normal times. At least, things are consistent for at least a couple days at a time now, compared to March where, things were consistent for a couple minutes or hours at a time. So we'll watch for updates because obviously this hasn't been launched yet. And we always appreciate you, Ron, giving any updates you can. And I know you're a big friend of the construction industry, and we really do appreciate your leadership. And on behalf of the construction industry, Jacob, it's a pleasure to be introduced to you. And I'm sure we'll be in touch, especially as this app rolls out. And through the CDAO and the CEC, these two groups and what they're able to do in their network. If you have any questions or are looking to reach out to the construction sector, I'd urge you to get in touch with the CDAO and CEC. Because we pretty much through our networks can get you in touch with anybody in the construction sector and probably hundreds of thousands of workers and related employers. So thank you both very, very much. Those were great presentations, and I think without further ado, we'll move on to a legal presentation from Mike Sherrard. So for those of you who don't know, and I can't imagine there's that many, Mike Sherrard is the founding partner of Sherrard & Coos. And his bio is quite lengthy, and that's because he's very accomplished. He has his routes in labor and employment law, but his specialties don't end there. And so I'm not going to go on too long, but I am going to highlight that he just did join the Skills Canada, Skills Ontario Board of Directors. And so that is a group that's very near and dear to me as well. And so a big congratulations to him on that. But I think it shows just how connected and how well he understands all the sectors of construction. And so thank you, Michael, for making time and joining us today. And now that I'm done talking, I will make sure I bring up your presentation.
Okay, can you hear me now, Andrew?
Yep, coming in there.
Thank you, appreciate it. So number one, thank you for having me. In this next while, I'm going to try to take you through the agenda that you see before you on the screen. I'm going to try to cover off very briefly, just really a review in terms of how COVID-19 fits into a workplace hazard. Instead of just talking about occupational health and safety, I'm going to touch on the duty of care. And then when you think of the information around the apps, and really probably more the government app than any of the private sector ones, I want to talk to you a little bit about achieving a reasonable balance and how that fits into the overall legal structure that may come and apply to this. For example, if an employer tried to require all of their workers to use one of these devices. Ultimately, this is all about protecting employees. I want to comment briefly and give you some information around the global experience to date. Jacob made mention of that. Many countries are in the midst of trying these kind of apps, and some have had great success and some haven't, and I'll try to comment on those. Along with Trace Scan that was raised earlier, there are a number of private other offerings that are starting to pop up, and I'll just list those more than anything. And then finally, some next steps to consider for anyone who's attending with us today to think about as you leave this in terms of what do you do, from my perspective, to best prepare for potentially the use of the app that Jacob is working with the federal government and the Ontario government to get released. So with that, Andrew, if we could go to the next slide, please. So I think it's taken for granted that COVID-19, with COVID-19, we see that as a respiratory infection, serious workplace hazard for the construction industry. And look, I adopt some of your comments, Andrew, at the beginning of the session, where kudos to the construction industry and the government working in partnership to frankly lead. And I agree with Ron's comment that many of the learnings we had early in construction have now been spread out into other sectors, and those other sectors have clearly benefited from all the hard work that all the stakeholders did. We know that the symptoms are, I say straightforward, but then if you read them, I think public health continues to update their advice to us, but clearly symptoms are fever, cough, sore throat, headache, fatigue, myalgia, and conjunctivitis. and that's a plain cough. We know that we want to encourage everyone to contact their employer as opposed to simply coming to work if they have symptoms. We know that we want to, and we've heard our premier a number of times talk about the encouragement to get tested. We know that the system and availability of testing has increased incredibly since March, and the turnaround time on test results has improved as well. We know that if a worker is infected, that there are serious risks, and I list those out. And then at the end of the day, all of us on this call, I think about our occupational health and safety obligations, how the law is developed, some of the due diligence around this. And I think Ron talked about it too in terms of the hierarchy of controls. But I think myself, I look at the hazard assessment, and then can we manage it? What can we put in place to make sure that it is manageable? And the app that they're talking about, I don't think any of our presenters today would say the app is replacing things, but I think I'd catch Jacob's words where he says the app is meant to complement all the other efforts that are being made to identify and contain and hopefully wipe this all out by the time we're done. So if we can move to the next slide, this is something a little different than simply a health and safety look. The duty of care for me when I'm interacting with all our clients really emanates out of health and safety, but it's a bit of a broader way to look at things. And if you look at that quote down below, it suggests that we all have obligations toward others and the public in a prudent and cautious manner to avoid a risk of reasonably foreseeable injury. So we already understand that there is risk of injury or risk of illness in this pandemic if we don't have prudent rules to follow in place. So we might start with something as simple as public health guidance around hand washing. Andrew, your reminder in terms of social distancing, in terms of use of mask. Those are the easy ones. The framework to think about, though, is in the duty of care, look at all the other things it touches upon. So Jacob's comments earlier about that social responsibility beyond a workplace on the left, our own fiduciary obligations if we're running a company and we're an employer, the legal obligations that we already know exist under the Occupational Health and Safety Act, let alone under the Emergency Act that's in place and the guidance that we're getting from our Chief Medical Officer of Health. And then juxtaposed against that, I put it in the right-hand corner on purpose. We know that there are individual privacy interests. And this app is the app that Jacob is talking about, and our two governments are talking about a partnership, clearly have taken those considerations top of mind. It's interesting if you surf the Ontario government sites and you get into their description of contact tracing, they don't simply say exposure notification application. It's actually been titled privacy first exposure notification application. And it really jumps out at what they're attempting to accomplish by what I call essentially a balancing of interests. So if we could go to the next slide. In this next slide, I think this applies for everything. All employers have been served well by public health guidance. The government of Ontario's continued guidance that we see, and Andrew, you made the point earlier, yes, things are slowing down in terms of change, but this is continually evolving. And so one of the issues for most employers is to try to stay up to date. And one of the best places to stay up to date, quite frankly, is public health guidance. It's updated on a daily basis. And I think I can't think of a better place to look, because remember with duty of care, it says there's a standard that all employers should be playing to. And where do we find that standard? Well, we know we find it in the Health and Safety Act. We know we find it in regulations. We know we find it in health and safety associations, policies and programs, and employer guidance. Right now, we complement that with public health guidance. I think that's very clear in terms of if an employer was trying to figure out where that standard is, I don't think they're safe simply to look at health and safety. I think they have to combine it with public health guidance. And that's where we get back into the duty of care. And the duty of care requires, I think, all of the employers, as we start thinking about this app, where does it fit? Do you actually have a policy that will cover it or not? Is there a program? And I'm going to suggest as we go through the rest of this session, I'll talk about some things at the end where I suggest, with all this information we've been given by the government, and most recently by Ron and Jacob, what do we go do next? And those things are, I intend to cover before I'm done. I put the Quinton Steele case on this slide simply to raise it for everybody, because if you go back and look at Quinton Steele, many of us found that decision fairly surprising. And so this, just by way of a quick synopsis, this was a case where the worker wasn't working at a height that would typically engage requirements for fall arrest, I think is how I would put that best. And I'd invite Ron to jump in and correct me if that's the wrong way to put it. But we looked at it as the worker was working below that fall arrest provision. And in terms of the accident that occurred, there was still culpability, even though the employer was able to say, but that worker wasn't working above the threshold that we usually have to have fall arrest at. I think in the court case, though, they said in this context, we still find culpability. And so I use that case to say, I don't think, and this just, I'm repeating on purpose, I don't think simply complying with Occupational Health and Safety Act and regulations will be enough. I think we have to be very contextual, and COVID provides that context for the purposes of why this app is going to be so important. I keep talking about employer responsibility, and I don't want to forget the internal responsibility system that frankly keeps so many people safe. It's a shared responsibility from my perspective. We always talk about engaging not the employer obligations, but also how do we get employees to buy in to what our expectations of them are to keep safe. That's going to be a critical piece in terms of what we'll talk about a little bit later called adoption. How many people are actually going to use this app and function with it? You know, Jacob's comment about it working in the background, some people have used an app where you actually have to have it open all the time, and that wasn't very successful. So kudos to the government in terms of the development of an app that is in the background, but it's still going to rely upon voluntary participation, and I'll have more to say about that as we go. We know that there are significant charges and fines and remedial consequences if we have accidents and/or fatalities. And I really don't need to comment on that. I think most employers and employees and trade unions are all quite aware and aren't driven simply by these fines or risks. They're driven by wanting people to go home every day safe. But I couldn't let that one not sit there as one of the possible consequences of failing to do some of these things. So if we move to the next slide, I've titled it The Challenges of Duty of Care. And these challenges are frankly, we start with awareness. And so that sometimes is making sure that people are aware of both their respective obligations and duties. And it goes back to, I think, Andrew, you may have mentioned it at the beginning, that watching out for when people start to get, my words for a moment, a little bit complacent or feeling, frankly, too safe. I think we see that as Ontario moved through stage 2, and now we're actually talking about stage 3. There is a bit of worry that people will get too complacent, and they won't, for example, remember how hand washing by itself can be so beneficial, or why wearing a mask when you're in a hallway crossing by a worker or on a site, why that mask is going to be so important. And then as we move to the app, I think the biggest challenge around this app, number one issue will be how many people can we get to actually use the app? Because remember Jacob's answer to one of the questions. If somebody beside them doesn't have the app, then that's not going to function. The more people that have the app, the better chance we have of this, what I'll call a system, frankly, actually functioning. And so I think the challenge is going to be for government and employers to provide people with enough information to overcome what I'll call, in my words at least, this general reticence to have anybody get near our personal health information. And remember, Jacob, if he was not on mute, would be saying, no, we're not collecting personal health information. And I agree with him, by the way. This app is not designed to collect personal health information, but I think we're going to have to convince people of that. And so somebody who has a technology background, they're going to get it really easily. And frankly, maybe somebody of a younger generation will get it. But I still think there will be a part of our population that's going to worry that by putting this app into their device, they're actually giving the government, or God forbid somebody else, access to their personal health information. So somebody asked the question or proposed, and I really do think that the government's going to do a great job of communicating the nature of this app. And I think employers can also assist them when they communicate the nature of this app, because it's really going to take growing trust in the app to get the percentage of adoption that will make it very effective for all of us. So there's a bit of a communication influence approach that needs to take place here. From an implementation point of view, getting used to the technology, I would bet, Andrew, you've got members of your organization and a number that are on this call that also have policies around the workplace about no phones. And so we have to think a little bit about what are the kinds of things that we need to look at potentially amending or at least turning our mind to maximize the possibility that this app will work. And so that, you know, the wearable versus the app that our government's looking at, it's going to take a little bit of look to us to look internally first. What kinds of things are going to get in the way? Who's going to pay for some of these things? Because maybe there's some costs that employees, as an example, haven't had to bear before, that may have to be borne by somebody or shared by somebody to actually get them in an accessible manner to actually download the app. And then for me, another challenge is we have multiple stakeholders. We have a common interest, right? We want everybody to go home safe every single day. We want to flatten this curve. We don't want to live through that second wave. We want to keep things open if at all possible from an economic perspective. I put them in that order on purpose, but we've got multiple stakeholders to have to buy into common issue and resolution. And remember, we're taking contact tracing in the very, very resource intensive process and takes a fair bit of time into trying to automate it, not to wipe it out. These are going to be complementary processes, but it's going to take some time to get people to buy into that automation, especially with people who will inherently have that worry around their own personal health information. And then finally, the other thing that is going to be a challenge is everything I've read so far is certainly the federal government. I'm not sure I've heard the Ontario government talk a ton about this, but I believe they will. The federal government has made it very clear. This is all about voluntariness. This app will be voluntary. And so the issue when we make sure it's voluntary and you pick the most privacy sensitive solutions like Bluetooth versus GPS, you also affect the effectiveness of the app itself. And so I think there'll be some dialogue around this. Australia would be the best example I can give you, where when Australia came out with their app, they also put new legislation in place that prohibited employers from requiring the use of the app in the employment situation. So those are the kind of challenges I think we're going to have to figure out and sort out as we go. And then if we go to the next slide, I really do think this is a bit of a three-legged stool approach. Just a quick picture. I think it's going to take, and I've left sort of society out on purpose for a moment. How are the employers and the government and employees and trade unions actually going to come together here to achieve a reasonable balance as we adopt this app, hopefully? And so if we go to the next slide, here's a little bit of a framework, and it's a really easy one. It's easy to say, it's harder to apply. We know there's a legitimate issue and objective, right? To keep people safe, to dampen the curve, and not to see a second wave. So I think it's going to be hard for anybody to argue that we don't have a serious issue and an objective to reduce that issue. Once we get everybody to agree that there is in fact a legitimate need, we also are going to have to demonstrate that the app we're using actually is effective. And so there'll be some statistics down the road that will become quite relevant to, is the app the right thing? Is it too privacy intrusive or not? In most of the case law, everything from the TTC cases to the Western oil cases to other construction cases, It's all about, is there a legitimate need we can address in the least intrusive means possible? That's what the test is all about. So again, a legitimate concern that we can address in the least intrusive means possible. And that's the critical piece. I put in brackets for my own purposes, but an effective approach. And I'm a little bit worried about the process we're following, and there are trade-offs, and I'll talk about those as we go. So when we look at manual versus contact tracing, 100% I agree with Jacob's comments around the manual tracing. It's effective. Public health has been doing that since the 30s, right? That's been going on for a long, long time, but it's time and resource intensive, and the app is going to allow us to complement it. It's going to incredibly increase the speed with which we can move, and it should capture the people that somebody who tested positive won't remember from an accurate perspective in terms of who they had contact with, or frankly didn't know because somebody was behind them in a grocery store lineup, or they sat on a bus with somebody. They're not expected to remember those things. So this app has a very, very legitimate impact that will be positive, and we hope the more people that adopt it, and I'm going to keep repeating that, and I hope employers and the government talk to society and their employees about adopting this. The higher percentage, the better chance this is going to be effective in flattening that curve. So if we move from there, here's a chart that I'm hoping isn't too small for everybody's eyes, but the chart itself tries to give you a pretty quick look from a global perspective. And I want to pick on India for a moment. If you go down to the very bottom, three from the bottom, they talk about the global experience to date, and then they use India, and they said the adoption rate was 7%. India also, instead of the voluntariness, for their public health folks, actually made it mandatory. And there's a study out of India where the mandatory requirement to use an app in India actually had a fantastic impact on reducing the spread of COVID in the public health profession. And so the chart's a little bit deceiving in terms of that small percentage of uptake. And then nobody will be surprised, frankly, in China, where it is not voluntary, that they had a 90% uptick with respect to the use of the app. And many people on this call would probably say, well, the legislative structure and the ability for the government to intervene in one's individual privacy is starkly different than what we want here in Canada, let alone what we safeguard. And so kudos to the government in terms of saying they're going to take a voluntary approach. But I think Ontario employers are going to ponder, is there anything better than a voluntary approach if we don't get the adoption rates we actually need? And I'll try to touch on those as we go. So let's talk about Canada's plan thus far, and I'll try not to overlap too much. Remember, it is not replacing any of the other initiatives or strategies that we're using. It's a complement, so it's in conjunction with other initiatives. It's clearly intended to be voluntary, and we should wait to hear from the Ontario government with respect to whether they'll follow the federal government's approach. Will they actually legislate or regulate and require the voluntariness in terms of how this app is used? It may be different legislation if they're trying to also impact upon what an employer might go and try to use outside of this government app as it relates to an earlier question in one of the slides I'll cover. It's clear that in all the studies globally, and somebody asked this question, Bluetooth technology is less privacy invasive, but it, frankly, they say is less effective than GPS. But many people will worry, and we've had some cases in Ontario about GPS and how it intrudes on somebody's privacy. And there'll be arguments, I think, but ultimately, Bluetooth is where the federal government is heading. I suspect that's, to Jacob's point, that's where the Ontario government is heading. And it's certainly less privacy invasive, so it should stand up to anybody's test that they've used a more invasive tool than available. I think Bluetooth's a great idea. The next piece to ponder when you read about this, people will be looking at whether or not the data being collected is centralized, like it is in Alberta, or is it decentralized? And my understanding of the approach here in Ontario thus far, what is being planned is for a decentralized approach, but I defer obviously to both Ron and Jacob if they have more current information. The decentralized approach means that the information actually rests on the user's device, and again, therefore becomes less privacy invasive to the user. And hopefully these are the kinds of things that will sell people on adopting the app so that our adoption rates go way, way up. The challenge and the balance is the methodology being followed by the federal government and our provincial government are privacy sensitive, but necessarily as a result, potentially less effective than, for example, a Chinese approach to this, or a China approach, I should say. And remember, we make the choice to do this voluntary. We make the choice to have a balance between less intrusive means to achieve an objective. The benefit to all of this, I think, is because it's voluntary and the government has picked two methodologies that are less privacy invasive, we should be able to communicate effectively with the population and really, really increase the adoption rates. That's the win in terms of the methodology, I think, from the outside looking in terms of the government's choices. But as this app comes out, I think we're also going to need public strategies supported by employer associations like those hosting this call to get out there and educate and inform their membership so that they can also cascade messaging down into the workforce, because we are going to need these public strategies to maximize adoption rates. If we go to the next slide, I won't spend a lot of time, but I wanted to leave this for our readers. This next slide is simply, here are some of the other private consideration apps that are out there. I shouldn't really lump Alberta in, but there's some evidence around the Alberta AB Trace Together app now that's out there a little ahead of us. And there are, I think TraceScan was raised earlier. There's a contract product. There's a group up in Ottawa, the Caber Group in construction, who have developed something called Caber Trace. Again, I think Caber Trace will be much more like the description of a wearable device as opposed to an app to be downloaded. And then PwC has a check-in device that frankly was used more, I think, I'm not positive on this, but I believe more GPS location based, but I stand to be corrected on that one. But just for our listeners' sake, here's some other ones outside of the federal and the Ontario government approach. I'm not here to sell you on any of those. I simply wanted you to be aware they're there. So now what do we do with all of this? And I wanted to put this in a bit of structure. So if we look at this next slide, I'll just talk about it briefly, but it can give an employer some structure. If we see the app coming, you already, I assume everybody on this call already has a very robust health and safety system. They've integrated public health guidance with respect to how they're operating a site. And so the next thing is to plan a little bit. What are those tools I have? Do all of my workers, as an example, have an ability to download this app? What do I need to do to try to address that? You've already done a lot on sites already with respect to identifying the risks and limiting exposure. But now this app is going to help us, right? The app is actually going to speed up and identify risks that frankly feel like they're a bit invisible right now. So I really do think this app is a great idea. And then the next piece becomes that response. A couple of things to remember in Jacob's presentation, if you go back and look at his slides, I think the way this is set up, it's up to the person who has downloaded the app. They, on a voluntary basis, when they get a COVID positive test, voluntarily decide whether or not to send that signal out, the code, as I think Jacob said, that somebody will get from the system. So they're going to get the code from the system, and they're going to be able to use that code to actually convey out to all of those other people who have the app that may have been, to Jacob's point, in that sequence, the 15 minutes, the within 2 meters, and so forth on that slide. But it's up to the individual, I think, if I read it so far, not up to public health, but up to the individual holding the app. So there's a bit of a vagary there as well. And so we have to think a little bit about how are we going to communicate and influence or encourage people to, in my words for a moment, stick their hand up. The best part is they stick their hand up anonymously, and that should be incredibly emphasized as we try to get these adoption rates. It's one thing to download the app. It's another thing for the person who tests positive to then use it to warn everybody, essentially. The anonymous piece, I hope, is the sales feature that gets so many people actually to use this. If we go next, I'll just leave you with some final next steps to think about. It's critical to stay up to date. That's been one of the challenges, I think, all along. I think it's getting easier. Organizations like those who are hosting today are providing you with updates. The Ontario government website and its very sector-specific initiatives, I think, have been a huge benefit, but keeping up to date is going to be critical. Watching as this app rolls out, I think Jacob said the expectation is over the course of the next couple of weeks, but I would start to get ready for how am I going to communicate to my workforce with respect to, I hope, an employer's desire that their workers will also embrace this app. And so there's a bit of a plan. Do people understand the Apple, Google, the differences in wearables as opposed to not, and the technology? As you would expect, right? When we look at working at height in the programs that Ron reminded us of, can you leverage government resource? Are there going to be educational materials? My bet is absolutely there will be, but can we cascade and help the government in terms of getting the information out there? The voluntary nature piece, there's the trade-off. Even though it's voluntary, is there a way, and I mean this seriously, to communicate and influence people, but in a voluntary manner? I'm not talking about wink, wink, nudge, nudge. I'm actually talking about, can we sell to our employees why this is so important and so effective for all of us, as opposed to any kind of inappropriate influence, I guess I'd say. But it's all about talking with our employees and our trade union partners as well. Increasing adoption rates is the real win out of this app. We've got to get a high percentage of adoption rate. And I don't think that's going to be easy. I think we're all going to have to work together to get that done. And then finally, think about the create, communicate, and coach. And what I mean by that is take a look at your policies. We've looked at some policies here at Shared Coups already where there are some gaps in terms of how to implement the app. So we're trying to update, not create from scratch, but update some policies, address the needs specifically to, for example, the construction industry, no phone policies. How about collective agreements that may have some cost consequences if you're requiring somebody to use a device? And then it just boils down to drafting policies, communicating them effectively to the workforce, and training people to them. And then we'll be back, it's the full circle, right? Draft the policy, communicate, train to it, and then audit its compliance. So fairly simple, straightforward steps. I'm hoping that's been some help with respect to the employer considerations with respect to this app. I close off, Andrew, with simply saying kudos to the federal government and the Ontario government in the development of this. And it really stands to be seen with respect to adoption rates. The adoption rates are going to make or break this. Those are my comments, subject to any questions.
So thank you for that. And it looks like we do have a number of questions, so I'll turn it over to Amina to start working through those.
Yeah, so I'm going to start with the questions that I think Mike is more in line to answer. There are some more questions that Jacob could also jump in on. So the first one, can employers require everyone to use the app on a site?
So horrible employer answer, right? But I have to start with it depends. We're going to have to watch and see what the government does. Does it actually have any legislative or regulatory guidance that actually prohibits it? Because I think if you can strike the test, legitimate need, least intrusive means, I think employers, and I mean this, may be able to require this. And employee advocates and trade unions, we need to be in the discussion together to try to sort this out, because you don't want a requirement and simply it becomes a case that says you're invading privacy. So first things to look at, anything in a collective agreement that touches on a privacy right or an employer's right to do this, then that balancing test, legitimate need versus least intrusive means. And so some employers should think about the following. Least intrusive means may say, to Jacob's point, this app is for one sole purpose. It shall not be used for any disciplinary consequences. So that's one way potentially to quickly address what may be a challenge that will be brought forward by employee advocates or trade unions. So depends, but I actually think it is possible that we could have employers requiring it of their workforce absent government guidance. Because remember, right now in Ontario specifically, the federal government is guided by the Federal Privacy Act. Then we look in Ontario, and while we don't have a complementary act, for businesses, we look to the federal PIPEDA piece of legislation. And PIPEDA suggests that it doesn't apply to an Ontario employer unless the information is being used for a commercial purpose. So there's a debate. Is this information in the app used for a commercial purpose? Doesn't look like it from my perspective. So I think employers could be in a position to actually require this. But again, let's wait and see what the government does by way of guidance as well.
Okay. And then kind of related again, if it is mandatory, if it eventually does become mandatory, could employers implement their obligation to contact trace and notify employees who may have been exposed through this?
Okay, I'm not sure I caught the question, Amina. So if it does become mandatory, can you go, I guess, could we go that one step further and say, not only is it mandatory to download the app, but if you've got a positive test, now it's also mandatory to send the signal out, for lack of a nicer way of putting it, in terms of using Jacob's words for a moment, or my words. It's possible. The key, I guess, when I back up, is what an employer will say is there's guaranteed anonymity, and that guaranteed anonymity may give that basis. That's a really critical piece of this that Jacob's team and the federal government are working on. The ability to guarantee anonymity, I think, may address the privacy concern, and therefore the legitimate need to keep more people safe may outweigh the privacy concern because of the anonymity piece. But again, I'm brainstorming a little bit of the kinds of arguments I think you'll hear as people get into these issues.
Right, and Jacob might want to jump in here.
Yeah, I was just going to say, so I mean, so you know, a couple of things. First of all, if that question was referring to an employer's obligation, either by the province or otherwise, to carry out contact tracing. So again, to recap, the app's not going to fulfill that obligation because it does one thing and one thing only, which is send an anonymous notification. So if you're thinking, okay, you know what, I'm going to use the app and I've ticked that box, again, that public health contact tracing process is still going to run its course. And you know, again, just to be crystal clear on that, if you do test positive, you are still going to get that call from public health at a point in time. And that's a provincial public health role that is being played wherever you live in the province. Your local public health unit will give you that phone call, independent of whether or not you choose to tell people through the app. So you're still going to be asked to, you know, who can you recall being around, and so on and so forth. The app is kind of one slice of the bigger pie. So it's not, you can't just say, hey, you know, I've ticked the box and I'm good to go. Again, I mean, some good discussion here about, you know, on what basis and whether PIPEDA is applicable and so on and so forth, and what basis does it are employers able to require use. So look, what I will say at this juncture, I mean, as we prepare for launch, and again, we're finalizing the guidance and we'll be quite clear about it, but we will, in the messaging that we are launching with on day one, we're very clear about the fact the app is voluntary. We're also very clear about the fact that our channels will be available to users if they feel that they're being compelled or coerced to use the app in a way that is, you know, not in line with its voluntary nature. So that, I would think, would be a deterrent out of the gate in terms of enforcing use. And again, look, you know, it's as we talked about with Andrew in advance of this session, you know, it's a delicate balance that we were trying to strike here. We're really, as the province, saying we want to proactively and very, you know, I know what the word is, with all of the resources that we have, promote the use of it. But at the same time, if someone on your site says, look, you know, for reasons of my personal freedoms or my own, you know, ability to make my own decisions, I don't want to use it, it does remain voluntary. And so our hope is that, you know, by using carrot rather than stick and saying, look, we're all in this together, you download the app, it's safer for everybody, you're incentivizing people to use it rather than coming at them with punitive measures such as we're withholding your pay or we're not letting you on the site. It's more about, hey, don't you want to be able to feel comfortable that you can go home to your kids and your family at night and know that you've got that peace of mind that you're going to know if you've been exposed. And I don't mean to sound cliche when I say that. I think there's certain, you know, value in that way of presenting it.
Another question for Mike. Is an employer safe to install the app brackets push on all company phones.
So so in other words, do it unilaterally without the user's consent because the company itself owns it, right? And it's a great one from the perspective of let's assume you can unilaterally download it because you own the phones. Be interesting for Jacob to comment too in terms of whether or not the app has to have anything turned on. We know it works in the background. Your next piece is you're not going to be able to require, even though if you push it out, you're not going to be able to require the person to use the code that comes from the positive test, right? That's going to take voluntary usage. And I like some of Jacob's comments in terms of how we're going to try to sell carrot versus stick in terms of how this gets done. So I think you could push it out. I don't know that it becomes effective unless you've also found a way to cause your workforce to buy into the use of the app when it in fact is you need to use it to be able to send out that signal. If they don't buy into that as well, I'm not sure the entire purpose of actually downloading it yourself. Because remember the other part that's key in this, and Jacob maybe can confirm this, I believe the intent is to have it decentralized, which means it sits on an individual's phone as opposed to anybody else having centralized control.
Yeah, that's correct. So it's certainly not running through any employer infrastructure. And again, there's no data to collect, right? Because it's not collecting your location. It's not collecting who you've interacted with, anything identifiable. So literally, if you were to steal somebody's phone with the app on it and hack into the app, you just see a list of these random strings of numbers. So they don't mean anything by themselves by design. And so again, it's not anything that runs through corporate infrastructure or corporate IT infrastructure. If you put the thing on everybody's phone, again, as was mentioned, they have to opt to send the code. I mean, you can't stand over their shoulder saying, "Hey, send the code." First of all, it's not practical. Second of all, again, the point is it's voluntary. It's their decision if they want to notify others. So you can, take the proactive step of saying, "Hey, you know what? We've installed it." Now, again, everyone's got a work App Store account, right? So it has to be done through the individual's App Store account as well. So you can't bulk and kind of push it, but if you're giving new devices with it pre-installed, sure, you can do that. And we'd encourage the kind of making it as easy as possible for folks to use it. And so I think maybe that's the acceptable middle ground where you're saying, you know what, it's on your device, it's there for you. But again, whether you want to use it, if you want to turn it off, if you want to uninstall it, that's your prerogative at the end of the day.
I think we're running out of time quickly here. We'll turn it back to Mike for any kind of final thoughts, and then we're going to offer some closing remarks.
Look, my final comments really are a reasonable approach. Do the things you need to do to increase adoption rates. So that means communicate as effectively as possible. Try to address, you're probably going to end up having FAQs to try to address the kind of questions we've already heard here today. But it's really about convincing as many people as possible to adopt this app. And I think the methodology, the choices the government has made gives us a real shot at having a higher adoption rate. But for me, that's the key. And then take some proactive steps to look at what do you need to address with your workforce before the app's even rolled out. That's it for me, Andrew. Thank you for having me.
Yeah, and thank you for your presentation, and thanks again to Ron and Jacob. I think just as a closing, when you look at where we've come from mid-March, a lot of it's been based on some of the stuff that you touched on, Mike, which was teamwork and coming together to figure out solutions. And I really like that triangle or the bar stool, the idea of as employers, as unions, and as government, we got to figure out this together. And the bar stool is a great graphic because obviously as soon as you lose one of those legs, you're in a bit of trouble. And so the message of we need to work together to get this adopted makes a lot of sense to me. And I think one thing that I probably should have touched on earlier is the role of joint health and safety committees. And so I think a lot of people on this call, are working in a unionized environment or are aware of unionized environments or have, policies based on what's done in the unionized environment. And I think joint health and safety committees on site, but also those joint committees, whether it's through the Chief Prevention Office or IHSA or different areas like that, the amount of work they've been able to do together is incredible. And oftentimes when labor and management with government can come together and you can kind of get a tripartite agreement, you're probably pretty close to a really good answer. And so I think this probably lends it to it. I know moving forward, and as you said, Mike, things are changing and they're still changing quickly, maybe not as quickly as they were in March, but I think based on the flurry of questions that we kind of got right at the end, we are going to need to keep watching this. And so one other thing that you kind of said was we need to take a step-by-step approach to this. And so obviously we're going to stay in touch with Jacob and with both levels of the government, and we're going to figure out when this is going to launch, how it's going to launch, and we're going to be promoting it through the industry. I know CDAO and CEC will be taking leadership roles in that. And we would encourage all associations and construction associations and groups to also push and promote this app. And I think based on that step-by-step approach, once we get it launched, and once we get some initial and early adopters, we're going to need to come together as a group and as an industry and reassess and figure out what the next steps are to really get that critical mass as you kind of discussed, Mike. So thank you for your comments and thank you to everyone for participating. We will get this out to everyone as soon as we can. Everyone who registered with Eventbrite will get it in their inbox. So if you didn't register, it's probably still not too late, or send me an email and we'll get you registered. Other than that, thank you everybody, and try to enjoy the rest of your day. And when this app comes out, please download it. Thank you everyone.
Thanks, Andrew. I'll circle back.
Yeah, thank you so much. That was great.